Namaste, I am Dr. Namitha, Chief Physician, Dheemahi Ayurvedic Center. Today I will be talking about diabetes mellitus. It is one of the most relevant topic in the present scenario, especially India being the diabetic capital of the world. Not only in India but all over the world, the number of diabetic patients are on a rise. Almost 10% of the world population is said to have diabetes. Being an Ayurvedic physician, I feel obliged to share the possibilities that Ayurveda can offer in the effective management of diabetes mellitus. In Dheemahi, we have been treating both type 1 and type 2 diabetes successfully. If you are a diabetic patient, is it mandatory for you to take insulin or metformin lifelong? Through proper Ayurvedic treatment, strict diet and exercise, you will surely be able to reduce insulin and metformin doses. If you are not a chronic diabetic patient, if you have been recently diagnosed with diabetes or if you are in a pre-diabetic stage, you will be able to completely stop the diabetic medicines with proper Ayurvedic treatment, strict diet and strict exercise. In type 1 diabetes, those with the adult onset, we were able to reduce insulin intake significantly, and in type 2 diabetes, in most of the cases, we were able to reduce the dose of metformin to half or 1/4 of the dose, and in many cases, we could completely stop metformin usage. So, it's not mandatory that you have to be a lifelong prisoner of diabetes. You can lead a very healthy life without being addicted to these medicines by proper treatment, but you have to be very strict with your diet and exercise. Before coming to the treatment part, let us see what is diabetes and how it is caused. As you all know, diabetes is caused due to the reduction in insulin produced by pancreas in the body, which result in rise in blood sugar level. Diabetes is of two types, type 1 and type 2. Type 1 is an autoimmune condition. In this, the body's own immune system attacks the beta cells of the pancreas, which produces insulin. So, most of these cells gets distracted, resulting in very little or no production of insulin at all. The type 1 mostly happens from the childhood itself. That's known as juvenile diabetes. But there are many cases with adulthood onset of type 1 diabetes. Next is type 2 diabetes. In this, the body comes to an insulin resistant state, later resulting in reduced insulin production. Now, when you have food, it gets digested in your gut and the food particles get converted into small molecules, say carbohydrate. It gets broken down into the smallest particle, that is glucose. Proteins are converted to amino acids and fat into fatty acids. So from the gut, these molecules, they enter your bloodstream. From here, they are transported to each and every tissues by insulin. So glucose is a must for each and every cell in your body to function. The cells derive energy from glucose. So basically, the tissues take in the required amount of glucose that is needed for their functioning, and the rest of the glucose is converted into a storage form called glycogen. This is done by two tissues. One is muscle tissue and the next is liver. Almost 500 gram of glycogen is stored in your muscle and 100 gram in liver. So, when you have more quantity of food, especially rich in carbohydrate, then more glucose will be produced and each tissue takes whatever is needed for it, rest converted into glycogen. But if the amount of glucose is more, which is in excess even after its conversion to glycogen, what happens to those glucose particles? They get converted into lipid and gets stored in the adipose tissue. Thus, the fat gets deposited in various parts of your body, especially around the belly area. This is the first sign of insulin resistance. If you are going on having more and more carbohydrate, more glucose is transported towards the tissues, and the tissues are now in a fully saturated condition where they need no more glucose particles. Especially if you are not exercising, then the excess energy is not spent. Then what happens? The tissues will shut down. They won't take any more glucose. So when the body reaches its maximum limit, where the tissues get overloaded with glucose, the glycogen storage is full and the tissues no longer can accept any more glucose. They start to resist it. This will eventually lead to insulin resistance. Once your body develops insulin resistance, then what happens? The pancreas will have to produce extra insulin for this glucose to be forcefully taken into the tissues. As a result, the pancreas works more and more. There will be excess workload to your pancreas. The beta cells which produces the insulin gets hypertrophied. That means they will increase in the size and also in number. When this goes for some period, these cells gets eventually destroyed. This results in reduced production in the insulin than the normal limit. As a result, the glucose level in your blood rises, resulting in diabetes. So when you develop the insulin resistance, body shows many signs. One is increased belly fat, dark pigmentation around your neck, armpit, excessive sweating, the urine becomes little frothy, thirst increases, you will feel more fatigue. This stage is called pre-diabetic stage. And if you take proper measures at this stage, you can prevent the development of diabetes and you will be able to come back to the healthy state. So now let's see what all factors results in insulin resistance. First one is wrong food habit. That means you might be having excess quantity of food, but still the quality of food won't be good. That means you won't be getting all the necessary micronutrients and vitamins, even though the bulk of the food is more. That means the carbohydrate part will be more. Eating more of junk foods, oily, fried, greasy foods, excess sweet, sour and salty food. Next is Viruddha Ahara. That means incompatible food items. These are food items which should not be mixed together or taken together. If done, they will act as toxins in your body. For example, having curd and fish, milk and fruits, especially the sour fruits, even banana. Then heating honey or taking honey with hot water. All these are Viruddha Ahara. Next is untimely food habit. Most of the people, because of their busy work schedule, have a habit of missing or skipping the breakfast, and they might not be having even proper lunch. But what they do to compensate this? They will have an extravagant dinner, very heavy and late night dinners. These food doesn't get properly digested because after having dinner, within 1 to 2 hours, you will go to sleep. And the food particles doesn't get digested, which in turn turns into toxins in your body. These toxins produces inflammatory reactions. This can cause serious damage to your body and health. Second is lack of exercise. When we do exercises, what happens? The glycogen stored in the muscles gets converted into glucose and they are used for the energy needed. So, once the glycogen storage is diminished, what happens? The muscle will be able to take more and more glucose from the blood. So, if you are not exercising, the capacity of muscle to take the glucose reduces because it already have a good glycogen storage. Third is sleep. A proper timely sleep, that means nighttime sleep is necessary to establish a proper circadian rhythm in your body. Your body has a biological clock which works in tune with the environment. So if you don't sleep in the proper time, what happens? This gets disrupted, causing various health issues. The fourth is stress. When you are stressed, more epinephrine is produced in your body. Your body will be in a fight or flight mode. This results in more inflammatory reactions in your body, damaging your health. So if you see, all these factors produces inflammatory response in your body, which can result in insulin resistance. So it is very easy to prevent and overcome this insulin resistance. You have to correct these 4 habits: proper food, proper exercise, proper sleep, and try to reduce stress. When you have food, try to limit the amount of carbohydrate. Try to include more vegetables and proteins into your food. Exercise is a must, especially morning walks. It has 2 benefits. Along with exercise, you will get abundant vitamin D. Resistance training, cardio, strength training, swimming, yoga, cycling, all these exercises are very beneficial. Now coming to the treatment part, diabetes being a metabolic disorder, the first step is to correct the metabolism. For this, a body cleansing is necessary so as to eliminate all the toxins and to reduce the inflammation that has happened in the body. For this, we do Panchakarma. Treatments like Vamana, vomiting, Virejana, loose motion, Vastis, enemas, and Nasyam, nasal medication. Through Vamana and Virejana, the toxins get flushed out from your body. Next is Vasti. Even though Vasti is contraindicated in Prameha, there are some very specific Vastis which will help in healing and regenerating the pancreas. Along with Panchakarma, treatments to reduce the inflammation, improve the circulation, and strengthening the muscles are also done. We also give yoga and meditation sessions which will help in reducing the stress level. Even though this is the general protocol, the treatments will be more personalized according to each person's condition. The severity, chronicity, and complications are all considered while giving the treatment. Now, before ending this session, I would like to give you 2 tips that you can follow daily. 1. Morning gooseberry juice. Take 4 to 5 Indian gooseberry, make it into small slices, put it in a blender and add 1/4 teaspoon turmeric powder. Blend it and make it into a juice. Have this every morning in empty stomach. This will help in controlling the blood sugar level and also to reduce constipation, which is quite common in diabetic patients. Second, take a spoon of Triphala Churnam, add half spoon ghee and 1/4 spoon honey into it. Mix well and have before going to bed. This will protect your eyes and prevent complications like diabetic retinopathy. Also, it will help to reduce constipation. If anybody in your family have diabetes, there is a chance that you can also get it in the future. But don't worry, you can prevent it. Just follow a proper strict diet and exercise. Have a good sleep and stay away from stress as much as possible. By keeping this much in mind, even if you have a predisposition towards diabetic, you can prevent it and lead a healthy life. Thank you.